All right. Well, this is the first for both of us here. The first for the ASB newsletter. I'm Max Paquette. I'm an assistant professor of biomechanics at the University of Memphis, and I'm joined here with my colleague Blaise Williams.
Hi, I'm Blaise Williams. I'm the director of the VCU Run Lab at Virginia Commonwealth University.
Right. So thanks for doing this with me, Blaise. We'll see how this goes first time around. So
I'm excited.
Yeah, I think it'll be fun. So the whole concept here is that we want to create a video to basically be able to promote biomechanics outside of the ASB. So having an audio file stored somewhere online could be distributed over the World Wide Web across a larger population. So our topic of discussion today for this audio file is basically the use of biomechanics in practical settings. So I'll discuss the use of biomechanics in the sort of sports performance or coaching standpoint, and then Blaise will address some applications in the clinic. All right. So Blaise, let me kind of get this started by asking you a question about what you do a little bit, but specifically, how in the past years, how have you been able to apply biomechanical concepts in your clinic specifically, whether it's working with patients or runners?
Well, it's changed a lot, Max, in the past 10 years, even in the past 2 years, as technology has changed. And I think we have a lot greater opportunity now to directly apply biomechanical concepts to the patient population. But prior to this, we were, as a biomechanist and a physical therapist, what we were able to do is to engage in research on, say, a Monday, and gather information over a number of patients over a period of time, and then, in theory, on the following Monday, we could take some of the things that we learned over that week and try to apply them to a patient population. In today's world, we have the ability to provide real-time feedback and to take these biomechanical tools into the clinic because they're becoming cheaper and faster and more user-friendly, and to provide real-time feedback and real-time interventions to our patients. So whether it's trying to show someone how much impact they're imparting on the ground, or whether it's trying to show them how much their knee is bending at a particular time, we can provide that kind of information in real time.
Right. Yeah, I think the whole boom in technology has been tremendous for us as scientists, and to be able to apply things like that. And I think one challenge may be for physical therapists, especially new physical therapists, maybe excited about using fancy technology and whatnot. But ultimately, I think what may be lacking is a full understanding of biomechanics and really like what's important, right? There's so many metrics we can measure out there. And so in the clinic, I mean, how what would be your best recommendation for a new physical therapist coming in, excited about doing some cool work in a clinic, has access to maybe some 2D analysis tools or retraining biofeedback tools. What would be your best recommendation? How do they start? I mean, how do they get to the point where they feel comfortable with using certain metrics and whatnot?
Well, I think one of the first things is to there's a couple different ways to do it. You can teach yourself, or you can try to find someone who's knowledgeable and go to a continuing education course who's going to talk to you about these kinds of things. So and the important people, or an important resource to go to a continuing education course would be to find someone who is in fact doing the research themselves and involving the clinical interventions. So someone like Brian Heiderscheit, for instance, or someone like myself who does the research and then also is engaging patients. That's one way to really get a good understanding of what can we trust, what can we not trust, and what are the good clinical tools to use. The other way, which is a little bit tougher and maybe not as forthright, would be to dive into the literature and find out what are the important metrics that we can trust, what are the things that we maybe can't trust when we're doing these sort of clinical measures.
Right.
So I mean, I think again, these days with all of the literature and a lot of people being able to access literature a lot easier, we can get to these sorts of metrics and not just go on what's being talked about on Google as far as what's an important metric to look at.
Exactly. Yeah. One thing I've noticed lately, being friends or colleagues with several physical therapists who are into research and with others who aren't as into research, the common theme for those who aren't really on top of all the research is the first complaint is, I don't have really the time or I'm not quite sure where to look for these resources, and often they can't access some journals online, especially if they're not at an academic institution. And so I think one thing to kind of put the I don't want to blame physical therapists for some of them for saying, oh, I don't have the time, so I won't do it, because everybody's busy and we tend to try to find the time to learn new things. But I think one thing on our side as sports scientists or biomechanists who aren't physical therapists, I feel like we need to do a better job at really disseminating the information that is applicable to physical therapists or clinicians. Often I talk to physical therapists and I'm like, yeah, research is great, but for us, there's so many things that we need to think about, and it's hard to decipher some of these important factors from journal articles, sometimes. And so, I personally think, from having seen it with colleagues and friends, that again, biomechanists, whether it's via the ASB, via things like National Biomechanics Day or ISB and so on, is some information or even newsletters, or maybe audio files like this, as podcasts are a good way to do it, I guess, but we've talked about those a bit earlier. But just getting information out there in a practical, applied way, I feel like sometimes is lacking.
Yeah, you're right. I think one of the biggest things, because I can see it from both sides, because I live in both worlds.
Yeah, exactly.
And I do think that the information doesn't make its way to where it needs to.
Yeah.
So there's a communication chasm, if you will,
right.
that we need to do a better job of communicating the information, working together, bringing scientists and clinicians together. And what scientists do a good job of is generating information and proving what works and what doesn't work. What scientists do a bad job of is putting that in the hands of the clinician in a form that they can actually digest.
Right.
And then what clinicians do a bad job of is communicating what it is they need in a way that the scientists can understand it. So I think in some ways we're both in need of helping one another, but we're not communicating in a way that is efficient. And so, and like you say, we're busy on both ends. Scientists are busy mentoring students and generating data and trying to get tenure and things like that, and clinicians are busy treating patients and billing and trying to get raises and things like that. So it becomes very difficult for us we need to try to figure out a way to make this palatable and easy for both sides. I think that's the challenge.
Right. Exactly. I think that's a nice way to put it. We both have to work together, not just one way, but both. So on that note, sort of, it's a nice segue into sort of like the application of biomechanics in sports performance. Talking about communication, and I think we both work with college athletics, a little bit with consulting and doing some biomechanical analyses and whatnot. And from my end, working with high-level athletes, whether it's professional runners or collegiate athletes, often I get really frustrated from hearing parents or coaches or trainers, try to. I'm glad that they're using biomechanics and they're trying to learn it and express it, but often they get their information in the wrong places, and so I feel like the biomechanics reputation sometimes gets tarnished because so many people misuse words or misuse terms, and they try to apply it to athletes. Athletes get confused, coaches get confused, and it becomes a big mess. So from the sports performance side of things, or the sports biomechanics side of things, just like you mentioned, there's so many good apps, for example, on smartphones and tools to use to do some nice biomechanical analyses in the field. And I think that, again, the important part is the communication between the biomechanists and the coaches. And often coaches will get scared of data a little bit. You show them data and they get scared. And you mentioned the same thing with with clinicians. I think is sometimes it's shared in a way that is very confusing or not very applicable. So coaches generally want to know, how do I get my athlete better? How do I get them to throw farther, to jump higher, to make more baskets or whatever? And sometimes as sports scientists, we tend to overcomplicate things. And even though the nice tools are there, it doesn't mean that everything we can measure is useful. So what are your thoughts? What are your thoughts on having worked with, for example, like basketball and other athletes at VCU in terms of using biomechanics there?
I think you bring up great points, Max, and I think it's a frustration again on both sides by the biomechanists, by the coaches, and even by the players.
Yeah, absolutely.
Because the information either is not translated well or it's too complex. Mm-hmm. And one of the things that we've tried to do, at least, and without watering down the information, right, is to try to find out from the coaches or the strength coaches or the players themselves indirectly through the strength coaches and the athletic trainers, what is it that they want?
Right.
Because here's the reality of this. We can have all the data in the world, but if the coach doesn't want it or doesn't believe in it, or his philosophy or her philosophy is something that's totally different than the scientific approach, there's no reason to give them the information.
Right, exactly.
And so I think there are more coaches these days who are interested in metrics and information, but there's still coaches out there that don't. So I think the first step in trying to be successful in translating what we do to practice is to find out what the need is.
Exactly.
And that's the individual need, whether it's from an individual athlete who's not clearing hurdles the way that we want them to, or whether it's a basketball player who keeps tearing their ACL or spraining their ankle. Mm-hmm. Those are individual needs, but there may be team needs that they feel like the team's out of shape, or they don't jump well, or they don't get rebounds, or they're not scoring enough goals, whatever it might be.
Right.
What is the goal? And then we have to kind of back into that and say, do we have individually or as a team the expertise to be able to provide evidence or information that can help them? Exactly.
Yeah, all great points there, Blaze. I agree completely. I think I agree with you that more coaches are data driven now, and out of those coaches, some of them know what they want. Some of them don't know what they want, so they just come to you. I've had situations where a coach have come like, look, I'd love to use some data. I don't really know what I'm looking for. I just want my players to improve. What can we do, right? Now, in that case, always becomes challenging because there's so many things we can measure, and so to me, I always go back and think, okay, well, are there certain things that aren't going well, right? Why do you want data? Well, I don't know the exact metric. That's fine, but is there something in your game or in your team that's lacking? And so if they come up with a specific example, then I think it's our job as sports scientists of coming up with creative or new ways to gather data that will be helpful. And that's challenging often, and like you said, luckily some coaches are into it and they do their homework and they look things up, and that helps, right? But ultimately, to me, I think it's just I think a good piece of advice for sports scientists or biomechanists that are trying to apply biomechanics in a sports performance setting is letting the coaches come to them. Often sports scientists will be like, look, I have all this cool instrumentation. I know I have a PhD. I know what I'm doing. Let me make your players better. And that sometimes, can come off as a little too strong, and some coach will be turned off by that, and then all of a sudden you've basically separated yourself from the possibility of helping. I see it a lot, especially in young folks who are just getting into biomechanics or physiology or whatnot. But in any case, I think it all goes back to communication, as you mentioned earlier, and it's good. The last thing I wanted to kind of bring up, Blaze, was speaking of in-field or clinical measurements. There are so many different types of wearable techs and instruments out there now. And so, I had a conversation a couple of days ago with a physical therapist here in town. I was like, look, what do you think about this and this and that? I'm like, honestly, I don't know all of them. There's so many. Some of them I've never heard of. So again, like, what are your thoughts? I have some things I'll come back with after you give me your thoughts, but I just want to know what are your thoughts on how to choose certain tools, specifically because there's so many out there and they're becoming cheaper and cheaper, and it feels like it's easier to have access to them, so anybody can really use them, but there's certain limitations.
Yeah, it's kind of like the Wild West, isn't it?
It's insane, yeah.
Well, everybody's got a sensor, and it's going to solve all of our problems.
Right.
For the most part, the technology, that wearable technology, it's all the same. People are just doing different things with it, right? And so it sort of depends on who's developed it and what is it that the metrics that they're putting out. I think it's great that we have the ability to measure ourselves in situ. I think that's a really cool thing. I also think it's cool that we can use that information to sort of augment what we're doing.
Right.
What I wonder about is that whether or not we're doing ourselves a service. Are we helping in any way? Because I don't think we have any evidence that shows any long-term results of these sorts of things.
Yeah.
Or are we doing ourselves a disservice because we don't understand the exact metrics that are important, and therefore we are moving ourselves perhaps in the wrong direction?
Right.
I think that in general, the technology is sort of ahead of what it is we have realized at this point from a biomechanical perspective, what's important and what we can do with it. That's kind of the way that I look at it. So I would say proceed with caution, but certainly proceed.
Yeah, exactly. Yeah, exactly. I agree. And I think there's a lot. We're still a long ways away from knowing all the answers. And like 99% of all papers out there's conclusion is there's more work to be done, and future studies should look at this and this and that. So we'll leave it at that for now. And hopefully for all people listening via the newsletter for the ASB, hopefully we can continue this discussion in August in Boulder and or other places. So thanks, Blaze, for joining me on this Friday afternoon. And
for setting this up, Max.
For sure. Yeah. Hopefully it works out. Hopefully people enjoy it, and we'll go from there.
Great.
All right. Thanks, Blaze.
Thank you, Max.
Cheers. Bye.